Hello everyone. Today's video is particularly for those about to be first-time moms. And I have several friends who are in that exact category. In fact, technically, if you want to be honest, I'm close friends with the grandma level, but that's still so exciting, and I love the almost first-time moms who are about to have newborns. So this goes out to you today, and there are several topics I want to cover before the baby arrives, and I hope that you guys find this helpful. If so, please like and even subscribe if you haven't already. And if you're about to be a first-time mom, I would highly recommend that you subscribe, because if you check out the baby playlist, there are a ton of topics already on there. So please feel free to use them. And as you know, subscribing is completely free. So as you prepare for the baby to come, if you're nearing the end of your pregnancy, I hope that you've already given some thought to preparing your nursery. Although I'm trying to be very practical here, I hope you realize too, the American Academy of Pediatrics recommends that the baby actually stay in the parents' room for the first year of life. Now, I feel passionately about safe sleep. I have done some videos on sleep, but may do additional ones about safe sleep. Safe sleep includes absolutely not allowing the baby in the parent's bed for the first year of life. The reason is that increases the rates of sudden infant death syndrome, what used to be called crib death. There are so many hazards with the family bed in the first year of life because the baby can become wedged, can become suffocated, can roll to its tummy and not be able to get on the other side, could be stuck between the mom or the dad, the arms. It's just not a safe idea. So what we mean when the American Academy of Peds says to be in the parent's bedroom, we mean in a safe sleeping arrangement right beside the parent's bed. It can be a small crib. It could be a pack and play. It could be a bassinet right beside of the mom. We want to save you from getting up in the middle of the night and having to go all the way to the baby's room. Remember, a newborn is going to have its days and nights flipped, so it's going to be up a lot more overnight and sleepier during the day. And you're going to need some rest. So already start planning on, I'm going to need some daytime naps. I won't need a lot of company during the day, but try to get some sleep at night in between the baby's feeds if you can. So already start anticipating the baby coming. If you've gotten a lot of clothes at your showers, go ahead and get them washed and in the drawers. Pack your bag for going to the hospital to include still maternity size clothes for yourself and the baby's outfits for coming home and diapers and your choice of wipes and things like that. So for items that I think you need to have, the most important one right now is a safe place for the baby to sleep when you return home, and of course the car seat. You shouldn't leave the hospital, obviously, without the car seat, and some of them will even do car seat tests. This is a great time for you to spend some time, hopefully even the dad, getting in the car, and I mean making sure that car seat is properly installed. It needs to be so snugly attached to the car that if you move the car seat, the car moves, okay? So you might have to get in there and put your knee in there and push down and pull, pull, pull. Different cars have different systems. Some have a locking system, which is awesome. The baby should always be rear facing for the first 2 years of life. The baby should always have the belts of the car seat snugly against the body so that you can barely get your fingers under it. The adjustable piece should be at the nipple line. The belts should come out just beneath the baby's shoulders because they're adjustable as the baby grows. Now, your baby won't always be in the infant car seat. It goes up to about 20 pounds. That depends on you, different manufacturers, but it should still be rear facing till 2, just in a larger convertible car seat. Remember that if it's wintertime, you do not want your baby to have multiple layers, including their coat and blankets, and then the straps of the car seat. You want the straps of the car seat just over like one layer of the baby's clothes, and then all the warm stuff piled on top of that, okay? Also remember, this is not where you want to buy used. You want a brand new car seat. There can be microscopic fractures in the plastic of the car seat from a previous car accident. So this is not the sort of thing you want to buy at a yard sale or borrow from a friend. You just want to get a brand new one for this, I promise. So rear facing till 2, straps tightly against the baby, make sure it's installed properly. Safest spot is the middle of the back seat, facing backwards, of course. So do make sure you have a safe place to sleep, a car seat. A digital rectal thermometer is very handy. Now, you can buy much more expensive ones that aren't as accurate. So there's really no reason to buy the temple scan and the forehead scan and all these things for a newborn. We're gonna make some pretty important decisions based on the exact rectal temp of the baby. And so if that baby has a temperature greater than 100.4 degrees rectally, if it's still under 2 to 3 months, of course, call your pediatrician in this situation, then we would want to see it and evaluate it. In the worst case scenario, with a high fever in a young infant, they have to go through a pretty extensive workup, including blood cultures, catheterization for the urine, a spinal tap or lumbar puncture to obtain some cerebrospinal fluid so that we can culture all three of those body fluids and rule out a bacterial infection. Now, sometimes it's just a viral infection, but we still have to do this because if it had been a bacterial infection, it could be life-threatening. So this is why you don't want a lot of company in those first few months. Anything you can do now to prepare your brand new little family for this upcoming event that will include needing to eat but not getting enough sleep, you might want to go ahead and think about freezing some meals, definitely accepting help from close family members. If they're just bringing you casseroles over, that's fantastic. I also want you to start thinking about any primary caregivers, mom, dad, grandparents maybe, a close neighbor, a close friend, a close sister, aunt, uncle. They should be vaccinated against tetanus, diphtheria, and acellular pertussis, which is all in one, called a Tdap. Now, the reason we really push Tdaps is for that app part, the acellular pertussis or whooping cough. Whooping cough can be fatal in young infants. So most moms will get their Tdap booster with each pregnancy. We would highly recommend the dad also get his Tdap booster, and any grandparents that want to provide childcare during those first couple of weeks, that would be a good idea. Also, the flu vaccine would be a very good idea for the primary caregivers and anyone else closely associated. Now, currently, this is January 2021 when I'm recording this. Of course, all visitors should wear a mask and should always carefully wash their hands. So all of these precautions were in place even before COVID, other than the mask. But they still obviously apply now. All those original bacterial infections and viral infections are still out there. It's just we're all focused on the pandemic currently, and that also matters. Infants under 12 months of age are considered at higher risk for COVID infection. So we do also obviously want to be very careful about that as well. So on your list of things I want you to have, preparation, talk to your family ahead of time, your car seat, your crib. You can prepare the nursery as well if you want, have everything ready for going to the hospital. So I hope that all makes sense, and already be kind of building yourself up to feel empowered to say no to excess company. For one thing, if you're planning to breastfeed, and I hope you are, you can read books about that, take classes about that now. You should only have people over if you're comfortable nursing in front of them or pumping in front of them, because you're gonna feel like you're doing that all day long, every day. So if you're not comfortable with those people being there, they're probably too far out of your immediate circle to have over right now, as young as the baby is. So as much as I love church, should you take your 3-week-old baby to church? Absolutely not. Will it hurt my feelings if I see you and your 3-week-old baby at church? Absolutely, because I don't want to be the one doing the spinal tap and drawing blood and cathing and starting an IV and transferring to the hospital for admission. Nobody wants your baby to go through that. So please, please, please be wise about that. Limit company, limit outings. You can always get takeout, or someone safe can bring you food if you're not able to cook yet when the baby's first born. Okay. So we covered a lot of information there. A lot of parents at this point also want to know what's going to happen in the hospital. And I'll just briefly go through this for you. Remember to use your lactation consultants in the hospital. They're a wonderful resource. Remember, and right now with COVID, you probably won't be able to have a lot of company anyway, and that is just as well. You're going to be tired. It's kind of a big deal to bring another whole human being into the world. But in the hospital, you can expect the baby to get its first hepatitis B vaccine. Excellent idea. Strongly endorsed. Definitely do that. You can expect the baby to get its first vitamin K and only vitamin K injection. The vitamin K helps to decrease dramatically the risk of your baby having a bleed. It is particularly brain bleeds that we are worried about, and studies confirm that these vitamin K injections do decrease the risk of the brain bleed, so definitely have that done. When the baby's first born, it gets erythromycin ophthalmic ointment in its eyes to help prevent any eye infections after delivery, which is also an excellent idea. So hepatitis B, eye ointment, vitamin K injections, all wonderful ideas. If the baby is born and is healthy and you do great with the delivery and it's a normal spontaneous vaginal delivery, the baby will be allowed to go home within 24 hours, particularly if you are group B strep negative. If there are complications, if there's a C-section, it may be 2 to 3 days before you're allowed to go home. At 24 hours of age, The baby will have a little heel prick done, and you'll see this white piece of paper with little circles on there. It's sort of a filter paper, and whoever's drawing that blood will get little blood droplets from the baby's heel and fill in those circles. It will go to the state lab, and they will run routine newborn screenings on it. In North Carolina, where I am, those screenings include ruling out cystic fibrosis, which is fantastic to be able to do that so early to get proper intervention if needed and follow up. It will rule out sickle cell anemia. It will rule out congenital thyroid disease and about 40 different metabolic disorders like a PKU, phenylketonuria, or maple syrup urine disease and things like that. So this is very valuable. That goes to the state, and then the state reports it back to the hospital and the primary care physician or your pediatrician. So that's why the hospital is going to need to know the name of your pediatrician. So that name on that form should be which office you'll be following up with right after delivery. Now that's another thing to remind you of. You will need to follow up at your pediatrician's office in 24 to 48 hours after discharge. If there's concern for high bilirubin in the baby or jaundice, we'll want you to follow up in 1 day. If there's no concern and there's no excessive weight loss, we'll have you follow up in 2 days. Also remember, all newborns lose weight, whether they're breast or bottle fed, and that's normal. We're only concerned when the weight loss is greater than 10. And then at that point, if you're still in the hospital when that happens, we'll tell you what to do. Or if it's after you followed up in the office, then we'll also give you some guidance. There are ways to supplement breastfeeding without jeopardizing that breastfeeding relationship, such as syringe feeding and things like that, that we can work with you on if necessary. It's not even always necessary. Do remember that with the very first baby, it's typically the longest amount of time for your mature breast milk to come in, but the colostrum is essential, and you need the baby on that breast about every 2 hours to bring in your full milk supply, and so that the baby gets all of that colostrum. It's very important. So I would encourage you guys to watch the other videos on the baby playlist that relate to your newborn, and just encourage you to get all the rest you possibly can right now, and get everything ready and prepared. Maybe get some good takeout as a couple and enjoy these last few days as baby free until the baby arrives. I know you're tired. Hang in there. I have always believed that the tiny bladder of the last stages of pregnancy were to get you sort of in the habit and the rhythm of nursing that baby every 2 hours, because it's hard to sleep for long amounts of time even now. So if you can, get some rest before that baby comes. I'm very excited for you guys, and congratulations.